Tonight on Nation to Nation, COVID-19 has hit First Nation communities. Kahnawake has 5 people infected with the virus.
The virus is in our community. It is spreading.
But are all First Nations taking it seriously? There's been stories of illegal bingos being held on one First Nation, for example.
This is serious, and you can't take any risks.
I'm Todd Lamoran, and welcome to Nation to Nation. The COVID-19 pandemic continues to grow every day with no foreseeable end in sight. There's been 5 confirmed cases in Kahnawake, Quebec. There's also a confirmed case in Saskatchewan. Yesterday, the Assembly of First Nations declared a state of emergency on the COVID-19 pandemic. It was also yesterday that Indigenous Services Minister broke down a $305 million emergency community planning fund. First Nations will receive the lion's share, $215 million. The funding is expected to flow to First Nations by April 1st. But is that enough? To talk about these things, I'm now joined by Bellegarde, National Chief of the Assembly of First Nations. Welcome to Nation, National Chief.
Good to be here. Thanks for the invite.
What do you hope your state of emergency will accomplish?
Well, what we're hoping by the declaring the state of emergency is that we will have a greater heightened awareness and a greater focus on the needs in First Nations communities. Our First Nations communities have overcrowded housing. We still have over 50 plus boil water advisories, so it's very difficult to wash your hands continually. So there's got to be a very strategic focus and a very strategic focus of resources, both human and financial, to meet those needs that will be coming forward because of COVID-19.
Now, when it comes to social distancing, we've heard reports that VLT lounges are still open on some First Nations and they're not observing social distancing, and that under-the-table bingo has been reported from one First Nation. How well do you think First Nations are getting this message to socially distance in addition to all those other things you talked about?
Well, I think that's the other aspect. I think our people have to take the seriousness of this pandemic that's going out across the world. This is serious, and you can't take any risks. If our First Nations people don't follow all the recommendations from the health officials about social distancing, self-isolation, stay at home, this could really be rampant amongst our communities. And so we've urged all the chiefs and council, all the members, the citizenship, all the young people to listen and stay inside. You can always do social media through Skype or whatever social media tools are available right now until this passes. But right now, the message is simple. Stay home, self-isolate, be healthy, be safe. That's the message to all of our people.
Of course, it's going to be difficult in some First Nations with overcrowded housing, as you mentioned, and no clean potable water. How can you do that when you don't have these things?
Well, that's precisely the challenge. That's precisely the point we're making to governments, and that's exactly why we made this statement of emergency and this call to action right now is to focus all levels of government, federal government, provincial governments, municipal governments, and our own First Nations government to make sure there's adequate human and financial resources in place to meet the needs. We don't have the same quality of health care as everybody else in Canada, especially for the 96 fly-in communities. They don't have access to hospitals. And so even simple things like making sure there's enough food at the northern stores or in the co-ops is going to be a big issue. Having access to rubber gloves and face masks and hand sanitizers and ventilators, those are going to be challenges. So in addition to the already overcrowded housing and lack of access to potable water, it's going to be greatly compounded, which is why, again, we're stressing to governments, make sure there's a very strategic and focused effort to meet the needs of First Nations people because we're not at the same level of health as everybody else in Canada right now.
And speaking especially of the federal government, how satisfied are you with the response from Indigenous Services, and in particular the $215 million that was earmarked to First Nations for emergency planning?
We all know that it's a start, and that's what we've said, and it should be based on needs, based on even in Treaty 6 territory, when you talk about the spirit and intent of the medicine chest clause. The Crown has an obligation to provide health care in times of festulence and sickness, and that's what's happening right now. So the Crown has an obligation, And it's a start. The 215 million is a start. It is scalable, and we've got assurances from the Crown that it is indeed a beginning, and that once further needs are identified, that the resources should and must and have to be there.
What more would you like to see in the short term to help First Nations?
Well, again, they've got the bill passed right now, and it's a beginning. You know, we want to make sure that all the needs are met. And this is the start of something that we don't want to see happen in any of our communities, you know, to see COVID-19 hit. But it's not a matter of if it will, it's when it will. And we better be prepared and make sure that there's adequate financial and human resources in place to meet those needs that will be coming. And that's our message to all levels of government. In addition to that, we're saying that our First Nations people have to be involved in any planning and design and development and implementation of any health emergency management plan. And there's going to be the other added case and need for medivacs if we have to take our people out of communities. And we have to make sure that they have those resources in place as well.
What have you been hearing? I mean, you've obviously been talking to a lot of leaders across the country. How much concern are they expressing to you right now?
A lot of concern has been expressed from chiefs. You know, they're concerned for their people. They're concerned for all their people, not only on reserve, but off reserve as well, in the cities, urban centers. And so they want to make sure that all their people's healthcare needs are met. And that's expressed from every province and territory. All the chiefs that have been phoning in and saying, look, we're not getting a proper response from officials and government officials here. We can't get our hands on the much needed resources that we need in our territories. So we're helping advocate, we're pushing governments, but the chiefs are very concerned, and it's right across Canada right now. And their message to their people as well should be heeded about staying inside, self-isolate, and take this pandemic very, very seriously.
Of course, some communities are self-isolating and restricting travel. Is this the way to go, or what more should be done?
No, a lot of chiefs are exercising that jurisdiction about only allowing their citizens back in. And even those that have been traveling, some are putting them into 14-day quarantine as well. So that's the right move. Let's really be proactive and take this seriously. And a lot of the chiefs should be commended for what those steps that they are doing because they're trying to keep all their members safe. And we have to do this together and keep in mind that we've got to get through this together and care for each other and look after each other and be mindful that this virus knows no boundaries, can hit anybody, can hit any community, can hit any family. And so we have to be very vigilant on making sure we stay home, self-isolate, wash our hands, watch the social distancing until this all passes.
And I'm assuming that extends to some cultural practices like sweats should be suspended for the time being.
Well, there's a lot of doctors saying that, and there's a lot of pushback from some of our spiritual people as well, that now's the time we need prayer. And yes, definitely we do need prayer. But again, practice in a very, very safe manner. We need prayer. We need access to medicines. All the things that our cultural teaching, our medicine people know that should be put in place for us. We have to rely on that. There's no question. But doing it in a very safe way and in a place where you don't have huge gatherings, it can be doable. Like, we have good teachings, and there's no question, and we have to rely on them to help us get through these tough times. And it can be done in a really safe way as well.
And finally, National Chief, have you heard, has Indigenous Services said enough that you're satisfied if a community really gets hit hard that they can mobilize quickly and do something?
Well, again, each community should have an emergency response plan in place, you know, and some do. You know, I think of Chief Todd Pegan at Pasqua. He's been ahead of the game now for 2 or 3 months by ordering supplies into his community, making sure that his elders' needs are looked after, and communicating through social media to the young people to stay in and take this seriously. Indigenous Services Canada has made a good response. You know, Minister Mark Miller is doing a good job in terms of getting the message out, and he's even put it out there that if there's problems in the regions, you can call his office directly to make sure that there's adequate human financial resources in place. So the answer is yes to that, but we have a lot more work to do to make sure that we keep the strength of our people at the forefront and the health care of our people at the forefront.
National Chief, I want to thank you for taking some time to talk to me. Thank you.
Thanks for the opportunity. Be healthy and be happy and be safe.
I will, and you too. After the break, we speak to the Commissioner of Public Safety in Kahnawake where there are multiple cases of COVID-19. Welcome back. As First Nations across the country wonder if the COVID-19 will hit their community, it already has in Kahnawake, a Mohawk community just south of Montreal. 5 people have been diagnosed, including a hospital staff member. Now joined by Lloyd Phillips. He's the Public Safety Commissioner of the Mohawk Council of Kahnawake. Thank you for joining us, Mr. Phillips.
Thank you. Good to be here.
Now, how are the people doing who have, with your confirmed cases, how are they doing now?
Well, the last I heard, they're all doing well. They're all following the proper precautions, staying home and self-isolation, monitoring symptoms. So last I heard, they're all doing well.
Have you been able to confirm the source of the virus in your community?
At this point, we can't. We have the regular public health agencies does their tracing. We cannot confirm exactly where the contact took place. We have some suspicions, but at this point, we cannot confirm. But the reason why we had went forward and had issued notice to the community that there was 5 confirmed cases wasn't necessarily to point to numbers. It was more about to inform the community that the virus is in our community, it is spreading, and that to reinforce the fact that we need to take the proper precautions and take the directives seriously, and your social distancing seriously, and that because now it hit close to home, it's time to ensure that you're keeping yourself safe.
Has Kahnawake implemented any measures like you've seen in Quebec and the rest of Canada for the entire community there? We have had a series of directive issues by the Kahnawake COVID task force, which includes very similar to what's happening around the province. But actually, we were ahead of the curve on most cases. We have closed down virtually all businesses in the community who are non-essential. We have reduced staff within the community organizations to the minimal essential staff only. People who can work from home are working from home, and we set up some emergency measures as quickly as we can to ensure that anybody who's impacted, by the virus, either infected or in isolation or have been laid off because of the measures taken, are getting some economic support as quickly as possible. And we also had set up our emergency food services for those in need. Have you had the need to ask for any outside help yet, whether it's from Indigenous services or the province of Quebec?
Well, at this point, we're fairly self-sufficient. Fortunately, we have the ability in our community to address many of the issues that are facing our community. What we did reach out to with them was on some of the personal protective equipment, which is a shortage across North America, for that matter, for assistance. If they could secure some of that equipment for us, that would be appreciated. But in terms of financial assistance and other assistance, medical and otherwise, fortunately, at this point, we are able to be self-sufficient and deal with the emergency as it comes. Every day is a new challenge. This pandemic there is no playbook for it, and that's not only for First Nations but around the globe. And we are dealing with it the best we can. And in the future, if this drags on longer, obviously the economic requirements to support what we're doing will become an issue not only for Kahnawake, all First Nations, but across the country as well.
You mentioned there's no playbook for this thing, so I guess is it hard for you to give any advice to other First Nations who may soon be in your shoes?
Well, my biggest advice would be, you call upon your community to have that community spirit. As First Nations, we are truly a community. Your friends, your family, your uncles and aunties and grandparents live in your same community. So you are more vulnerable than a non-native community. We all live together. Take that seriously, because it's very easy to transmit the virus to an elder, and they are the most vulnerable population. So take it seriously. Abide by all the recommendations that are out there, and stick together. It takes a community to get through this. We have our Kahnawake COVID task force team who's been giving directives and help guiding the community through this tough time. But without support from your community at large, you're gonna fail. And we have a very strong community spirit in Kahnawake. We have all sectors of the public sector working hand in hand. We have the business sector has kicked in and has donated and supported us throughout this. And that's how we're going to get through this with minimal impact.
Well, I hope that you do, and I hope that you and your community take care. Mr. Phillips, thank you for speaking to me.
Thank you.
Thank you.
Another break, and we'll speak to senior health officials with Indigenous services. Welcome back. When it comes to COVID-19, a lot has changed in 1 week. Dr. Tom Wong is the Chief Medical Officer for Public Health at Indigenous Services Canada, and Valerie Gideon is Senior Assistant Deputy Minister for the First Nations and Inuit Health Branch. They were on Nation to Nation a week ago, and yesterday Ms. Gideon participated in a virtual town hall with First Nations health managers. Talk about that and give us an update. They're here once again. Both of you, welcome to Nation to Nation.
Thank you. Thank you.
Now, yesterday we heard about the breakdown of the $305 million into $215 million for First Nations, $45 million to Inuit, $30 million for Métis, but only $15 million for urban Indigenous. Now, more than half of First Nations people live off reserve, so $50 million doesn't seem like enough. So do urban Indigenous people rely on provincial health services?
So I think the breakdown should be looked at a bit differently, where we know that First Nations communities are very concerned about their members that live away from community and want to be able to offer them that support. So the funding that First Nations governments will be receiving, they are also able to reach out and provide supports to members that live away from their community. The fund is intended to be very flexible. But the $50 million set aside for our organizations, or really for service delivery organizations that work in an urban context, friendship centers being an example, that serve members from across varying communities, health centers or other organizations. And as the minister said yesterday, this is not the end.
Now, of course, First Nations vary widely when it comes to helping off-reserve members. Some do and some don't get help from their chiefs and council. So if you're not getting support from your community during this crisis, what can you do?
Well, First Nations, Inuit and Métis individuals have access to all of the broader Canadian supports also that were announced as part of the COVID-19 economic response plan. So all the individual-based benefits and supports for workers and also even business supports also apply.
Now, you said earlier there's no cap on this initial $305 million. Of course, there's already complaints that it's not enough money. So if there's no cap, how much can it go up? 25%, 50%, or even more?
With the initial funding that had been announced on March the 11th, we were able to put out a community guide that has been distributed to all chiefs and councils and also through our regional offices. And communities have been sending in requests for additional supports that they require relating to the activation of their pandemic plans, and we are addressing those.
Now that we've heard that multiple cases have been reported in Kahnawake, for example, and there was a case reported from the Cree Health Board in northern Quebec and other First Nations in Canada, what should Indigenous services and First Nations in Inuit Health Branch be doing in response right now?
So we are, of course, supporting communities to advance their pandemic plans and responses and working closely with them to say, what is it that you may need as cases are confirmed, or to support those individuals that may have presumptive cases and need to self-isolate at home. I will also give Dr. Wong an opportunity to speak specifically about how we advance community supports in these situations.
Thank you. One of the things that's so important is physical distancing with social connection. Bringing in the culture as prevention and culture as treatment. It is important to listen to the elders, listen to the public health authorities about what needs to be done in the community so that safe distancing between individuals are kept. Also, it is important to practice hand hygiene, wash their hands often.
Now, the health minister, when she was testifying before the Senate yesterday, talked about using the Quarantine Act if people didn't social distance. Could this be applied to First Nations as well?
I think that First Nations communities have the authority to be able to implement protective measures in their particular communities, and that it would be involving other departments across government. So, for instance, ensuring that they continue to have access to essential health services.
What is the tipping point in the number of cases or positive identifications before a so-called surge capacity in that community can be enacted?
And I think we mentioned last week that really communities will call us. It's not about having 5 cases in a community. 5 cases may be too many for the existing health staff. Not all communities have fully staffed health centers, for instance, to be able to do the contact tracing if they're not able to access the necessary support from a provincial public health unit, for instance.
If they just simply don't have the capacity, all they have is a couple of nurses at a nursing station, I suppose is the plan just to fly patients down to southern hospitals?
So we can increase and are increasing the number of staff that are available in a nursing station context. But absolutely, we do not have intensive care units in those facilities. They're not equipped for that, and the staff are not trained to exercise those functions. So individuals can be stabilized within a community setting, but they would have to be medevaced to an emergency department in a hospital to be assessed and potentially entered into or admitted into the intensive care unit. I don't know, Dr. Wong, if you have more to comment on that.
Yeah, we would support the communities in whatever way that we need to be in order to stabilize the individual so that they can be safely transferred either to a secondary or tertiary care hospitals for the care that
and finally, the National Chief Perry Bellegarde talked about the 96 flying communities, remote communities, and they require increased supports and direct engagement in planning and preparedness. What has been done along those lines so far?
MKO in northern Manitoba is very engaged with respect to their Northern Health Authority that they are establishing, but also we will be having a specific focus, or are having a specific focus on the needs of northern Manitoba communities. And so those are the types of arrangements that are being developed across regions to ensure that there's a specific focus on remote and northern. However, we've also championed the establishment of a remote and northern Indigenous community technical working group that will report up to the Federal Provincial Territorial Special Advisory Committee on COVID-19. Dr. Wong, Regional Chief Academic from the Yukon, public health experts from provinces and territories, and Inuit and Métis representatives have been invited to participate in this group. It has started its work, and the goal is to ensure that public health guidelines that need to be adopted and specific recommendations and actions for remote and northern communities will be brought to the attention of federal, provincial, and territorial governments.
Okay, Ms. Gideon and Dr. Wong, I want to thank you for taking some time to speak to me.
Thank you very much.
Thank you.
Well, Alan.
That's all the time we have. If you have some spare time and you want to listen to previous episodes, check out our podcasts. Go to aptnnews.ca/podcast. I'm Todd Lamoran. Thanks for watching, and please take care of yourselves.